afternoon. It's both a joy and a privilege to be asked to contribute to the 5-year celebration of Trainee Nursing Associates and Nursing Associates. I'm Deborah Holden-Peth, Trainee Nursing Associate Operational Lead for Primary Care across Greater Manchester for the Training Hub and work in a dedicated team to support the development of Nursing Associate workforce.
And I'm Josie Hines, and I am the Social Care Trainee Nursing Associates Operational Lead for Greater Manchester with the Greater Manchester Training Hub.
We'd like to share with you how inspirational people and organisations have collaborated across social and primary care to support TNAs and NAs to become a reality. Including our spring intake, we have supported 99 TNAs into post across Greater Manchester, with 30 due to register from September 2022. If time permitted, we could talk all day about TNAs, but as time is limited, we'll aim to give you a snapshot of the journey so far and how we intend to continue to grow and develop. I'll hand over to Josie.
Okay, so a couple of years ago, 2 clinical leads who were passionate about introducing TNAs in primary care and social care across Greater Manchester worked in partnership with the University of Salford and the University of Bolton, along with support from Health Education England. So everything started enthusiastically. The first cohort were ready and raring to go, and then came the COVID-19 pandemic. So that cohort, who were meant to start in March 20, didn't start until September 20. But that 6 months gave us time to pause and regroup and work out how we were going to support employers and learners in this new normal. And to do that, we all work in collaboration. Employers, TNAs, universities, the Training Hub, Health Education England, Skills for Care, the trusts, other primary care organisations and other health and social care organisations. The list goes on and on. From a social care and primary care point of view, we collaborate on many aspects of the delivery of the TNA programme, one of which is the TNA Forum, which is delivered once a month by myself and Deborah, and we bring together all the social care and primary care TNAs that are on programme at the moment. And this is their forum, their safe space to talk about any challenges they have, share ideas and network. And we encourage TNAs to buddy up with one another from different cohorts and from different settings as well. We also have a collaborative social media pages on Facebook and Twitter, and the TNAs would love you to follow. This helps us raise awareness of the role and connect with the TNA wider community, both locally and nationally. It also gives us a chance to showcase the fabulous work our TNA ambassadors do to encourage the next generation to want to work in primary care and social care. From a social care point of view, we started very small with 6 employers and 13 TNAs who began their journey in 2020. The employers and TNAs from that cohort describe themselves as guinea pigs, but I think of them as trailblazers, paving the way for future cohorts. We're now in our 4th cohort, and the social care employers involved and learners involved is growing. And we have small organisations and large organisations, and the support each employer and learner needs is different depending on their starting point. So from working with employers, we identify new ways of supporting. A couple of ways we have done this for our current cohorts is encouraging employers to buddy up with each other. So an existing employer and a new employer, so they can support each other. And also delivering a practice assessor, a practice supervisor drop-in, where it's their forum where they can come and discuss any challenges and network and share ideas. One of the initial anxieties for employers was sourcing those external exposures. The Memorandum of Understanding in Greater Manchester means that social care, primary care and the trust can all collaborate together to facilitate those reciprocal arrangements. I think that's enough from me. It's time to hand over to the TNAs who are going to share their journey with you. So the first TNA I would like to introduce you to is Danielle Clark. She's a TNA from September 20 cohort with the University of Salford, and she was very nervous doing this video.
Hello, my name is Danielle and I work within social care. I've worked within social care for around 14 years. I currently work at Exemplar. Exemplar is a company that specialises in Huntington's disease, brain damage, mental health and learning disabilities. I attend Salford University once a week for my TNA course. When first starting out with the TNA programme, we didn't have much information, so it was quite overwhelming. This is due to us being the first cohort, so it was quite worrying, not having that much information. I was more worried about time management, so with work and children and family life, social life, and fitting the university workload on top of that. But I was also excited to further my career and knowing I'll be able to do more to help the service users and give them the care that they deserve. Since starting in 2020, my confidence has grown massively, and that's due to the knowledge and support that is given from the university, from my organisation, from the PEF team. It's just been second to none, and they believed in me when I didn't believe in myself, so that's also given me the confidence to carry on. Before, I was scared to ask any questions because I didn't want to sound silly or question someone about something. I shied away from multidisciplinary teams, but now I feel more confident in being involved in them discussions with multidisciplinary teams and asking questions. For the course, we go out on external placement. Going out on external placement gives us amazing opportunities to learn from other professionals and to bring it back into your own workplace. And with it being an apprenticeship, we can apply that knowledge into the workplace straight away. And with it being for the 4 fields of practice, learning disabilities, mental health, adults, children and young people, and throughout our career in social care and in primary care, we can come across service users that will have learning disabilities, mental health within children and young people. So this will help care for our service users in a person-centred way. For my future, this has changed from when I first started the course. As I said at the start, at first I was unsure of what the TNA programme was. So at first I was using this platform as a stepping stone to my nursing. But now knowing what we can do and being a professional in our own rights, this is amazing. We can work in any organisation and within the 4 fields of practice. So for this reason, I will be staying as a registered nursing associate with my organisation, and I've made plans with my manager to take more responsibilities from the nurse so they can do more complex clinical care and to make arrangements with GPs for bloods and injections. This will help take the pressure off the GPs and nurses and care assistants within their practice, keep me in practice, keep my skills and knowledge up, but also it's better for the service users because I've already built that trust and therapeutic relationship and I'm a familiar face. So that is what I'm going to do. Thank you for listening. Good luck for the future, and if you've got any questions, please ask Josie.
Thank you, Danielle. The next TNA I'd like to introduce you to is Deborah Taylor, and she's a TNA from September 2020 cohort, also from the University of Salford, and Deborah is a primary care TNA.
And I'm a trainee nurse and associate at Wesley Medical Practice, which is in the Wigan CCG area. I'm on the pilot scheme for the primary care trainee nurse and associate, so I'm in the first cohort for that. As a nursing associate, we're doing a generic role, so I need to gain experience in all 4 fields of nursing. But luckily in primary care, we are lucky because we get exposure to that on a daily basis, and sometimes one patient might fit into multiple categories and not just the one field. I'm a mature student, so although I'm working full time and studying, I'm also a mum and a housewife, so at the beginning of this I did wonder how I was going to fit all that in, but on reflection now, we're less than 6 months to the end and I can't believe that it's nearly finished. The reason I wanted to do the apprenticeship is, to be honest, I've always wanted to be a nurse. It was something I wanted to do when I left school, but life took me on a different path, and I enjoyed going out and working and earning a wage and living my life. And then I had my children and it honestly just felt like it was a dream. It was something that was never going to happen for me. So when this opportunity arose, I've just took it with both hands and I've just ran with it. I was at the primary care conference that was being run by the Greater Manchester Training Hub in Manchester City, and I was talking to one of the clinicians there who said the nursing associate role was going live, and so I was lucky really to get on the course. Had I not gone to that event, it could have took a different path. My biggest achievement to date, it's really hard to define just one moment that I'm proud of. I'm proud of myself for coming this far in the training because I've definitely had some tough times, but I have strived and I carry on and I will succeed. But as a cohort, I think we all need to be proud because not only have we been frontline staff in the middle of a pandemic, but we've also been studying for this foundation degree. So I think it's well done to all of us really. Primary care often gets overlooked because we don't have all the drama of that secondary care see, but what people actually forget is that it's our role to stop them from going to A&E, to stop that attendance or to look after them after they've been an inpatient and had a hospital stay. A point I'm proud of is promoting this role. So I did go to an online event to promote it to GP practices in Cheshire and Merseyside, alongside Health Education England. I went and I spoke, I did a presentation for that, and I got lots of questions at the end that I answered, and I got some really positive feedback, which I'm really proud of. So what would I say to somebody who was considering the apprenticeship? Well, at 35, I've got 2 children and a stepchild. I've got my partner, we've got dogs, I've got everything going on, purely parents, and I wondered how I wanted to do it, but I did not know how I would get through it. I thought childcare would be a boundary for me. And one of the partners sat me down and said to me, stop looking at every possible thing that can go wrong between now and the end of it. She was like, let's sign you up. Let's see how you go. And if you have to step off, you can step off and step back on again. But let's just see how it goes, and let's not think of them problems before they've actually arose. And that was the best advice that I got, because here I am right near the end, and yeah, I'm still going for it. I've managed to overcome any little obstacles.
Thank you, Deborah.
Thank you to the teenagers who contributed. They wanted to be the voice of their cohort and wish to be heard today. The success of any programme has to be based on quality, demand, resources, ambition and commitment. Across Greater Manchester, we have all of these in bucket loads. There is a quality programme provided by the higher education institutions with whom we partner. This generic programme has been carefully and considerately adapted and tailored to fulfil the needs of social and primary care environments. Employers recognise there is a need to develop a registered support workforce, the TNA. There most certainly was an untapped resource of ambitious, committed and talented healthcare support workforce who has the desire to develop and contribute to the care of people within their localities. Many of who thought they would never get this opportunity, but through the introduction of the apprenticeship and work-based learning, their dreams are now becoming a reality. The aim for the employer is not to destabilise an organisation whilst developing their teams to adapt to the changing needs of the service and to retain their new workforce. HEE have provided the support which allowed the momentum which initially started within secondary care for the role to be picked up in social and primary care. We've taken up the challenge and run with it. The support has taken different forms, forms from supporting the PEF roles, such as Josie and I's, financial incentive for the employers, and especially the introduction of the additional roles reimbursement scheme for primary care. And it's also facilitated the levy donations from larger organisations. The learners' experience start long before the enrolment onto a programme, and we often get expressions of interest from individuals, and it feels that they're tipping their toes in the water. And it's up to us and our team to support them and their employers on their journey in preparation for the programme. We can support an individual for up to 2 years before they're ready to take the plunge. The investment's well worth it. This programme is life-changing and part of a greater plan for many of our trainee nurse and associates, and an investment by the key stakeholders across primary and social care. They deserve our continued commitment to the development, to fulfil their potential and offer them careers in an environment in which they have trained. Our intention for the future is to promote their role within social and primary care, facilitate continued professional development, starting with the preceptorship, and embed nurse and associates within the workforce across Greater Manchester. Our team is committed to continue to listen, to learn, and to evolve. On behalf of Greater Manchester Training Hub and the Trainee Nurse and Associate team, we'd like to congratulate you all on your achievements and successes. Thank you.
Thank you.